Good morning, everybody, and welcome to the 8th session of CDC's Public Health Grand Rounds. I'm Tanya Popovich. I coordinate these events and work with our SMEs. And just to remind you, I'd like to welcome those who are watching us on our internet. And apparently we have a lot of people there, probably a lot more than we have here in the auditorium. Remind you that this is accessible live. This is also an opportunity to let people know that you can send us your feedback via email if you go to the internet webpage, which is on our CDC Director's webpage, and you can as well subscribe to receive information and alerts about these events. If people who miss some of these events can watch them on the archives, which is again both of our internet and intranet pages. One thing that we're very proud of is the fact that these sessions are eligible for the continuing education credit. And so those of you who may be interested can visit the continuing education webpage and get all the information that you need there. We have been doing now for a while, for about 6 months, coordinating the topics that we cover in the grand rounds with those that are covered in our science clips. And I'm very glad to say that we now have not only intranet, but also internet page for our science clips. Since this is a scientific event, just a little bit of science. This is the graph showing the increased viewership of these events. So we started with 100 people last November. We had over 9,000 people watching us live on internet last time, and this is how it went. It started by people watching us on the government premises. It moved to the stadiums and sport events. We were captured on Jon Stewart's show. And finally, scientific institutions are catching on. And so we're delighted to have Dr. Collins and Dr. Glass here, who are also a strong supporter of these events. So please stay tuned. These are the events that are coming up. And our director is going to say a few words now.
Thank you very much for being here. Welcome again to Public Health Grand Rounds. And I thank the program leads and SMEs who did so much work to prepare today's session. I also want to welcome again Dr. Collins, Dr. Glass, and other colleagues from NIH to this session, and remind people that at 10:30, Dr. Collins will be giving an update, which we're very much looking forward to, both in this room and also through the webcast. Nanotechnology is a cutting-edge field. It's an area where there is enormous potential to help, with more than 1,000 nano-enabled products on the market now, from stronger materials to more efficient fuel cells to disease detection technologies, but also has more potential for harm. We need to better understand toxicity, and as with an increasing number of areas, our ability to detect is not at the same rate as our ability to understand. So putting together the basic science with the epidemiology and translating that into what we need to do to protect workers is, I think, the challenge that today's session helps to analyze, and we look forward to learning from it, and thank you all very much for your hard work.
Thank you, Dr. Frieden. Good morning. I'm Paul Schulte, the Director of the Education and Information Division at NIOSH and the Manager of the Nanotechnology Research Center. Today, we are pleased to present an overview of nanotechnology and its potential contribution to societal well-being, and in particular, to identify the issues related to preventing disease and injury as the technology grows. Today, I will provide the overview, and then Dr. Mark Hoover will describe some of the health applications. Following that, Dr. Sally Tinkle of NIH will describe some kinds of research NIH has been funding extramurally and is conducting intramurally. We will then drill down into the occupational safety and health issues. Dr. Vincent Castronova of NIOSH will explain why hazard assessment of nanomaterials is challenging. Then Dr. William Hunt of the Georgia Institute of Technology will give highlights of the Georgia Tech Nano Focus. And then finally, we are honored to have with us Dr. Kristen Kolanowski from Rice University and Director of the International Council on Nanotechnology, who will describe global efforts in preventing occupational hazards. So I will start with an overview of nanotechnology and asks the question of whether or not nanotechnology, indeed, as it has been portrayed, is the third industrial revolution. In this presentation, I will address three questions. What is nanotechnology? How is it used? And what is the basis for concern about the health and safety effects? There are many definitions of nanotechnology, and they usually have three common aspects related to size, new or unique properties, and control of matter at the atomic scale. The nano world is a weird borderland between the realm of individual atoms and molecules where quantum mechanics rules, and the macro world where build properties of materials emerge from the collective behavior of trillions of atoms. Nanotechnology promises an unprecedented control over materials that we use and the means of their production. Such control could revolutionize every sector of the economy. To appreciate the actual dimensions of the nanoscale, this slide shows an illustration of the relative size of 1 nanometer. If the diameter of the Earth is represented by 1 meter, then 1 nanometer would be the size of a dime. In this slide, you can see how 1 to 100 nanometer nanoparticles compare to various small biological entities. So nanoparticles are generally smaller than red blood cells, and most bacteria, and they overlap or are smaller than the size of most viruses. Nanoparticles have unique properties not seen at larger sizes of the same materials. Each successive division produces a new generation of matter with completely distinct physical and chemical properties. So if you take a bar of gold, you cut it in half, you will still have gold with the same properties as the original piece. If you keep doing that at around a size of 60 nanometers, the resultant division has new properties, as listed on this slide. At the nanoscale, gold can vary in color from red to black, become highly reactive, and even be magnetic. The basis for many of the properties of nanomaterials is the vast amount of surface area per unit volume. Here you can see a gold cube 1 meter on a side that has a surface area of 6 square meters. However, if you cut it into little tubes approximately each 1 nanometer on a size, the surface area is approximately 6 billion square meters or 25,000 square miles, which is the surface area of the state of Delaware. Chemical and biologic reactions take place on the surfaces of nanomaterials. The more surface area, the greater the reactive potential. The nanomaterials that are of greatest concern for human exposure are the engineered nanomaterials, as distinguished from nanoparticles from a natural phenomenon such as forest fires or from industrial operations such as welding. These engineered nanoparticles can exist in an infinite number of combinations of physicochemical parameters. For example, size, shape, surface area, composition, charge, solubility, functional group, and impurities, to name a few. Because there are an infinite number of nanoparticles, there is a need to be as specific as possible when referring to them, or to clarify limitations when generalizing about them. There is great variability of nanoparticles of the same chemical composition. Each of these particles is the same chemical, zinc oxide, but each has a different shape and different physical and chemical properties. So what are the applications of nanotechnology, and why are they of interest? Nanotechnology is of great interest because it imparts new and useful properties to materials. These new properties make existing materials better, stronger, lighter, and more durable. For example, carbon nanotubes are 6 times as strong as steel and 1/5 the weight. They have enhanced electrical conductivity, and they will help build faster and smaller electronics and more powerful computers. All of these point to the possibility of creating new and very powerful applications. One of the greatest promises of nanotechnology is to build useful devices 1 atom at a time. To do this, there is need to see and manipulate individual atoms. This capability was illustrated in 1989 when scientists moved 35 xenon atoms to spell IBM. Another aspect of the potential of nanotechnology is to copy nature. Nanotechnology offers a way to make artificial building blocks that resemble the natural building blocks of biology and assemble these building blocks into artificial non-living systems that mimic features and behaviors of living systems. Nanomaterials can be used in every sector for many different purposes. Here are some examples. More efficient and targeted delivery of plant nutrients and pesticides in agriculture, lighter, stronger, self-healing materials in vehicles, targeted therapeutics and enhanced disease detection, more efficient fuel cells, food safety sensors, and improved water purification, just to name a few. As you heard already, there are more than 1,000 nano-enabled consumer products on the market. Nano-enabled means that it contains nanoparticles or it is made with some aspect of nanotechnology. Nanomaterials can also be used to address critical global problems such as energy and transportation. Here are some of the contributions to vehicles: better fuel economy, weight, and emission reductions. Nanomaterials also can make important contributions to medicine and public health. This shows a functionalized nanoparticle adjacent to a tumor cell, illustrating the potential for disease sensing, diagnosis, and targeted therapy. However, the same properties that are related to size, surface area, and heightened reactivity that make nanoparticles scientifically and commercially exploitable are also the basis for possible health effects. And clearly we can see how topical this is in a recent paper that just came out in Environmental Health Perspective showing carbon nanotubes in world trade dust. There are three evidentiary streams that serve as the basis for concern about the health effects of nanoparticles. First, from air pollution epidemiology, we see that smaller particles are related to respiratory and cardiovascular diseases in susceptible populations. Second, byproducts of combustion and industrial fumes, which contain nano-sized materials, cause various health effects, such as pulmonary and eye irritation, fever, and lung cancer. And then third, and perhaps most significantly, animal inhalation studies in the last 10 years with engineered nanoparticles showed various significant and irreversible health effects, such as pulmonary fibrosis, granulomas and inflammation, lung cancer, and mesothelioma-like effects for various types of nanoparticles. Also, nanoparticles, by nature of their size, can enter most organ systems. They've been shown to translocate from the nose to the brain and from the lungs to most organ systems. Some have the potential for skin penetration. Despite these evidentiary streams, there is still much that is unknown. There are four major gaps in knowledge about nanomaterials, particularly as they pertain to workers. We still know very little about the nature of the hazard, the exposures, the risks, and lack much of the information on how to manage the risks. We even know less about the hazards in the general environment. Nonetheless, NIOSH is at the forefront of nanosafety and health research, addressing each of these major gaps in dealing with a broad range of stakeholders. The greatest issue in hazard identification is that there are so many types of nanoparticles that they cannot all be studied individually. We need to identify hazard categories for them. For some, NIOSH has identified hazards such as pulmonary fibrosis and atherosclerosis. Mechanisms of action are also critical in making categories, and NIOSH has identified some such as tissue damage by highly reactive oxygen radicals. NIOSH has pioneered exposure assessment with some pilot efforts at 26 work sites where exposure levels have been determined, and this has been published recently in the Journal of Occupational and Environmental Hygiene. There are many issues in assessing the actual risk to the human populations. Since workers are the first people in society with relatively large potential exposures, developing epidemiologic studies will be important. At issue, however, is what endpoints to investigate, how to form cohorts with similar exposure and adequate latency. NIOSH has conducted risk assessments on titanium dioxide and carbon nanotubes and published extensively on this subject. In the interim, while we're waiting for information about risk, exposure registries have been suggested as a way to collect data, provide communication to workers on the state of knowledge of risks, and serve as sampling frames for potential epidemiologic studies. NIOSH has been developing guidance for workers who are currently exposed. This is something that is tremendously needed, and this kind of guidance is shown in the document in this slide here. So finally, with all this work, our challenge is that there are so many potential types of nanomaterials that we need to think smart about how to study them, and our challenge is not to repeat the mistakes that were made with previous technologies, but to realize the societal benefits from nanotechnology while protecting the workforce, the population, and the environment. Thank you. So now I'll turn it over to Mark Hoover, who will talk about some of the public health and other applications of nanotechnology.
Good morning. I'm Mark Hoover, Senior Research Scientist in the NIOSH Division of Respiratory Disease Studies. In addition to conducting hands-on research to improve measurement methods and information management for assessing and controlling potential exposures and health risks of engineered nanoparticles, I have the privilege of serving as the Area Coordinator for Nanotechnology Applications in our NIOSH Nanotechnology Research Center. I will focus on the current and emerging applications of nanotechnology for public health. These applications span an amazing spectrum, from prevention of disease or injury, to medical diagnosis and treatment, to reducing environmental and energy impact. A very informative compendium of those 1,000 currently existing nanotechnology-enabled products and applications can be found at the Woodrow Wilson Center's project on emerging nanotechnology, and the web link is listed here. Here are some public health examples of new products and systems to prevent disease or injury. The Life Straw uses a nano-engineered ceramic filter to remove waterborne contaminants at the personal consumption level. A larger water bottle version is also available, as are full-scale industrial versions for public water systems. Antimicrobial surface treatments, such as nanoformulated silver coatings, can reduce the lifespan of biological contaminants on the surfaces, thus reducing risks for spread of disease. Nanotechnology has even found applications as antiviral or antibacterial components in specially formulated gels and foams for prevention of sexually transmitted diseases. Applications for medical diagnosis and treatment include the use of gold nanoparticles that have been coated with a protein binding sites to enable a light beam to readily sense the presence or absence of hormones associated with pregnancy. These systems can enable both reliable and affordable home diagnostic kits, as well as advanced and robust laboratory systems, such as the magnetic nanoparticle cell sorter or the microarray laboratory on a chip system pictured here in this slide. The manner in which carbon nanotubes can simulate normal human collagen can be used to strategically insert nanoscaffolds to organize and stimulate the proper creation and repair of bone. In the area of reducing environmental and energy impacts, nano-engineered functional coatings on surfaces can prevent environmental degradation of surfaces, thereby reducing the need for costly repairs or replacements. This can directly reduce the need for maintenance workers to risk injury and death on scaffolds of high-rise buildings or even low-rise buildings. These kinds of green building applications are excellent examples of what we are promoting at NIOSH as prevention through design approaches. In addition, there are nanosurfaces, including insulations, reflective coatings, and solar systems, to control or enhance building heating, cooling, and energy use. And there are nano-enabled electronics, such as light-emitting diodes, that vastly reduce energy requirements to power devices such as computer screens and even ambient lighting. Enhancements to both quality of life and education opportunities due to the ability to read and study into the evening hours can be significant. This schematic example of nanotechnology applications in the food industry demonstrates how extensive the applications are and how easy it might be to construct similar diagrams for any area we might imagine related to public health. A quick highlight of the food-related applications include nano-enabled sensors to detect contamination, spoilage, or tampering of food products or food packages, nanobiotechnology methods for synthesis of healthful foods or foods that retain their healthful properties, packaging and labeling features such as printable radio frequency identification devices that are far less expensive than traditional silicon devices and can therefore be used more widely and economically to tag and track all types of products, including the personal protective equipment we test and certify at NIOSH. To summarize, nanotechnology can and is providing solutions across the spectrum of public health concerns. Our opportunities, as we move forward, are to both understand the scope of potential applications and to foster the matching of priority public health concerns with development and application of efficient and cost-effective nano-enhanced solutions. You'll hear more about partnering and information sharing opportunities in the following segments of our presentation. I'll turn it over to Dr. Sally Tinkle.
Thank you, Mark, and good morning. I'm Sally Tinkle from the National Institute of Environmental Health Sciences at the National Institutes of Health. And I'm here today to speak about our programs at NIH, and in particular, our research to prevent potential adverse human health effects. The National Institutes of Health is composed of 27 institutes and centers whose core mission is science in the pursuit of fundamental knowledge about nature and the behavior of living systems, and the application of that knowledge to prevent, detect, and diagnose disease and disability. Most of the NIH institutes focus on disease and organ system research. However, NIEHS has a role to examine the environmental exposures and their influence on the development and progression of disease. Looking first at NIH biomedical research, our research programs can be divided into three overarching areas: diagnosis and early detection, cellular and organ system function, and therapeutics and intervention. For example, if you look in the first column at the circular image labeled A, you see an atherosclerotic plaque in the blood vessel of a mouse. Through research done by the National Heart, Lung, and Blood Institute, researchers coupled a protein, an antibody that recognizes a protein in the plaque to a nanoparticle which could be imaged by nuclear magnetic resonance. This allows the clinician to not only diagnose at early stages the development of atherosclerotic plaque, but to trace the efficacy of treatment and the removal of plaque as treatment progresses. NIH was one of the founding agencies for the National Nanotechnology Initiative in 2001, and at that time we had approximately a $40 million investment in nanotechnology. As you can see, that has grown exponentially over the last decade, and in 2010 and 2011 we are approaching a $400 million investment. The vast majority of this research is focused on biomedical research questions. However, I'm going to spend the rest of my time discussing the research investment at my institute at NIEHS as it addresses primarily adverse health effects, which is the topic of today's Grand Rounds. In 2007, NIEHS developed its Nanotechnology Health and Safety Initiative with two primary goals. The first is to determine the relationship between the physical and chemical properties of engineered nanomaterials, as you saw described by Dr. Schulte, and relate that to the biological response that's observed in the human body. Secondly, we wanted to take this collection of data and identify nanomaterial design principles which would help us engineer these materials to maximize their benefit and minimize their risk to humans and the environment. This initiative has 5 research components. The first is material characterization, because given their size and unique properties, we need to develop tools and methods to find these materials in biological matrices and in the human body. We also, because we're NIH, focus on how these materials might induce a biological change in a healthy individual, as well as cause disease or affect the development or progression of chronic disease. We also are interested in developing programs to organize the data, an informatics component, and to develop predictive models which will assist in improved design and efficacy. And then finally, as with all emerging technologies, we have a training component to bring along the next generation of scientists who will have the interdisciplinary training to address the complex questions an emerging technology requires. Here are 2 examples of recent programs we've developed at NIEHS. We recognized the challenge to develop reliable and reproducible methods to assess the biological response to these materials in vitro and in vivo. Most traditional assays were developed to soluble chemicals and needed to be modified in order to be effective for nanoparticles. Secondly, we're in the process of developing a research network to focus on understanding more precisely how chemical composition and structural arrangements dictate biological interaction. We don't do this work alone. NIEHS frequently collaborates with other institutes at NIH, as well as our sister agencies such as NIOSH and NSF and EPA. 2 examples of our collaborations are shown here: the Nanoinformatics collaboration. The National Institute for Biomedical Imaging and Bioengineering leads this with collaboration from NIEHS as well as the National Cancer Institute. We also have a collaboration with the National Cancer Institute to create a database of the structural attributes of nanomaterials and their relationship to biology. So this is how our inter-institute collaborations develop. NIEHS is also proud to be the home of the National Toxicology Program. This is a research program that develops hazard data by good laboratory practice. These data then can be compiled into a gold standard technical report that can be used by regulatory agencies for decision making. I draw your attention here to one of the multiple materials that are under investigation at NTP, and that is titanium dioxide. At the nanoscale, this is being used in sunscreens, and NTP has contributed significantly to the research on dermal penetration of nanoscale TiO2, and their data are part of the FDA safety assessment that's being conducted now. So with that, NIH moves into the future and will continue to use nanotechnology to solve critical biomedical research questions. And also through our research, we are extending our presence in the global nanotechnology research community. At NIEHS, we will continue to focus on our Nano Health and Safety Initiative and expand the research in order to achieve those goals. So with that, I thank the CDC planning team for inviting me to be here today on behalf of NIH and NIEHS, and I turn the podium over to Dr. Vince Castronova from NIOSH.
Good morning. I'm Vince Castronova from NIOSH, and I will present the challenges in assessment of hazard associated with exposure to nanoparticles. Nanoparticles exhibit unique physical and chemical properties which are distinct from micrometer-sized particles of the same composition. These unique properties are being exploited for unique applications. Therefore, unique bioactivity of nanoparticles is likely. Of particular note, to date, nanoparticles are regulated by OSHA and EPA under standards for a defined size analog. For example, carbon nanotubes are currently regulated as fine graphite. This is most likely inadequate. Thus, hazard assessment is essential for nanoparticles. In 2001, Congress enacted the National Nanotechnology Initiative to foster the development of nanotechnology and the commercialization of new products and applications, while at the same time protecting the environment and human health. NNI now includes the research activities of 26 federal institutions. The NNI strategic plan lists goals and objectives of these federal research efforts. The NNI research priorities for human health are to develop and validate animal models to quantify dose response, and to determine the relationship between physical and chemical properties of nanoparticles and their bioactivity, to develop high-throughput predictive in vitro tests, and to extrapolate cell and animal data to humans. Issues related to the development of animal models are to determine responses of the nanoparticles given via different routes of exposure, that is pulmonary, dermal, oral, or intravenous, to evaluate responses at the site of exposure and at distal sites, to evaluate responses to short-term and long-term exposure, to evaluate responses to well-characterized sets of nanoparticles, and to characterize particles both as produced and as delivered to the test system. For example, nanoparticles agglomerate in physiological saline, and agglomeration is known to decrease the bioactivity of nanoparticles. Issues related to in vitro assays are, one must understand mechanisms of action for each nanoparticle in order to use the appropriate in vitro tests. For example, different tests would be used if the nanoparticle caused cell damage by generating reactive products, or if it altered cell division to form mutated cells. One must use doses in vitro that are relevant to those used in animal models, and one must be aware that nanoparticles may interfere with indicator chemicals used in the in vitro assays, or may absorb nutrients from the assay medium and thus cause artifacts. Issues related to extrapolating the results of human models to workers are to use relevant doses relevant to human exposures. Therefore, one needs human exposure data. Since nanoparticle activity depends on the degree of agglomeration, one should make an effort to disperse the test samples so the structure sizes that are used in the test are relevant to human exposures. Therefore, one must measure nanoparticle structure size distribution in workplace air. NIOSH has developed a biocompatible dispersion medium which does not modify the surface reactivity of nanoparticles. The NIOSH hazard assessment effort involves the evaluation of numerous nanoparticles listed here. We are conducting both pulmonary and dermal exposures and evaluating pulmonary, cardiovascular, central nervous system, and dermal responses. We are determining the relationship between physical and chemical properties and the bioactivity of these particles, and are developing predictive in vitro screening tests. Thus far, NIOSH has found that pulmonary exposure to carbon nanotubes causes rapid and persistent pulmonary fibrosis in mice. Pulmonary exposure to single-walled carbon nanotubes or titanium dioxide nanoparticles causes cardiovascular dysfunction, while pulmonary exposure to multi-walled carbon nanotubes and titanium dioxide nanowires causes inflammation in certain regions of the brain. NIOSH also has evidence that multi-walled carbon nanotubes can migrate from the lung to the intrapleural space, which is the site of asbestos-induced mesothelioma. Lastly, single-walled carbon nanotubes have been shown to interfere with normal cell division, resulting in mutated cells. Thank you. Our next speaker will be Dr. William Hunt from Georgia Tech.
Thank you. It's great to be here today, and I thank Dr. Popovich for allowing me to come and talk to you. So I'll be talking about nanotechnology at Georgia Tech, forging the small. So we're in the business of creating new technologies, and so part of what that says is sort of a test case for training these young people that are graduate students and postdocs going out into the world afterwards. And the issues of safety are very critical to what we do, and also ethical issues. So we work to develop new types of devices and systems and kind of try to extract this information at the nanoparticle scale to get information out of that. We collaborate with Emory Medical School and CDC, and this is of vital importance and a complementary set of skills. Basically, in the extreme case, engineers think of really cool stuff. We don't know what it's good for. So you guys help us a lot with that. There's also an entrepreneurial spirit at Georgia Tech, and so there's an effort to move technology to the marketplace. And an important thing, the last one here, is we're guiding students and postdocs. We are doing research, but really training these people, and they will go worldwide. We've got an international collection of graduate students and postdocs, many of whom will go back to their home country. So we're really kind of spreading information out to the world, and the training goes out to the world as well. There are a number of nanotechnology research centers at Georgia Tech. We are a member of the National Nanotechnology Infrastructure Network, and there's a new building that's online shown here on the right. There's a Nanotechnology Center for Personalized and Predictive Oncology led by Xiuming Ni, who's jointly appointed with Emory and Georgia Tech. A Nanomedicine Development Center, Gang Bao leads that, and also a Program of Excellence in Nanotechnology, also by Gang Bao. So we've got a variety of different large efforts related to nanotechnology and nanotechnology in medicine. So some of the aspects of this work include bioconjugated nanoparticles for molecular and cellular imaging. So having those bind to a cell and they assist in the imaging of those cells. Blood analysis. So one of the things on the photonic side is you can create with these structures optical characteristics such as a diffraction grating on a small scale, so you can shrink down something really tiny, so you're able to do infrared spectroscopy basically on a chip, so really small area. That's Professor Ali Adibi in my department. Fluorescent RNA probes or molecular beacons. These conjugate, then you get a fluorescent response out of this. The zinc oxide nanobelt shown earlier. So this is a piezoelectric material, and one of the aspects or potential applications of this is energy harvesting from implants. So motion within the bloodstream, for example, can generate charge, generate energy to keep some of these implants energized. And then nanofluidics, how do you get a fluid to move around at the very small scale? And that's Paul Cole. A couple of specific examples, a little bit more detailed here. This is a biohazard water analyzer using carbon nanofiber arrays. So as you see on the left here, the carbon nanofibers, you grow these in situ, hybridize them with single-stranded DNA, and then you look for the DNA strands that you're targeting, and then an electrical signal basically comes out and allows you to get the information. So part of what the nanotechnology does for you is give you a lot of opportunities to detect. And finally, my work. So I'm on the area between electrical engineering and the biotech stuff, and we've been developing for a number of years now acoustic-based devices that are capable of detecting conformational change as well as mass attachment. We have a variety of ways of extracting those signals. Also in the nano scale, so because of the nanoscale size of the device, we're up the gigahertz range, and so we're getting very, very fine resolution in the detection. We've also developed a nanoscale hydrogel, which allows us to get molecular recognition in the vapor phase. So we've got antibodies in training that. The nanoscale allows you to actually, it keeps hydrated, and we're able to, as shown on the right here, combining with the digital radio thing, which I see a lot of digital radio people out here in the audience today, so I'll just bypass explaining what that is. But basically, we're able to, on using the antibody promiscuity, discriminate between close chemical analogs, things that you couldn't discriminate with mass spec. And so one of the things we're looking at doing with this is detection of methylated DNA, phosphorylated proteins, try to see if we can get down to that level of what's going on within individual molecules. And lastly, ethics is not a four-letter word, so we're actually, wow, that was my biggest joke, and I got nothing on that. Ethics is wow. Because it's not actually four letters. But anyway, we've got an NSF-funded research group. Roberta Berry leads this, and it's trying to get these students that are being trained to be thinking about ethics early on in what they do. They do case studies and look at different issues out there so that they've at least embraced the complexity of looking at ethical issues. And I think I'm done with my time. So now I'd like to introduce Dr. Kristen Kolonowski from Rice University.
Thank you, Bill. I don't have any jokes because, of course, this is an extremely serious subject. I'm going to present some of the critical knowledge gaps that need to be filled to promote the safe use of nanomaterials, review some of the efforts that have sprung up around the world to fill the gaps, and present a concept for a focused project to accelerate this process. Despite all the great work, including what you've heard here, there are still significant knowledge gaps to fill based on deficiencies in the research that underpins responsible use of nanomaterials. These include an imbalanced emphasis on acute hazard studies over more comprehensive risk-relevant research, the lack of published research that addresses critical questions about occupational safety directly, and the lack of quantitative exposure limits to inform occupational practice. As a result, the existing knowledge base currently has little practical application to human health. Progress is being made to bridge the gaps by three distinct groups: governments, which are issuing guidance with high-level recommendations, international bodies, such as standard-setting organizations and intergovernmental groups attempting to provide some international coordination, and grassroots and consortia that have sprung up to develop interim strategies for managing risk in parallel with these other organized groups. Despite all this activity, there's still little high-level coordination. And finally, I'll bring it all together with a call for a highly focused effort to address issues of worker safety directly. The International Council on Nanotechnology, the group that I direct, maintains a comprehensive database of literature related to the issues of nanotechnology's environmental health and safety impacts, broadly defined. The pace of this research, as you can see in the graph, has grown very rapidly over the past decade. But if we dig in a little bit deeper, what we can see is that most of the papers focus on hazard. And to go a little bit further, most of the hazard papers are acute cytotoxicity studies. This is not surprising, and cytotoxicity studies are usually the first type of risk research to be performed in an emerging area. But without understanding where the exposures might come from in real-world settings, the relevance of these studies to human health is still very limited. Finally, occupationally relevant research, such as, for example, the efficiency of personal protective equipment or the flow of nanoparticles through fume hoods, is an especially critical knowledge gap. As seen here, these papers make up less than 6% of all the nano impacts research. The occupational safety research is lagging, and it's the very kind of research that those people in the nanotechnology community are looking for. In 2006, we surveyed nanomaterial manufacturers, users, and researchers in industry, academia, and independent and government labs from 4 continents via telephone and the web. And overwhelmingly, survey respondents identified a lack of knowledge about nano environment health and safety issues to be a major impediment to improving their occupational practices. They're seeking this information primarily from respected governmental sources, as many of them, especially the small startup companies, do not have the resources to invest heavily in their own internal safety research. Governments are responding to these calls for information. Each country that has an active program to fund nanotechnology research and development has a corresponding effort to produce and disseminate information about potential human health hazards. Many governments have worked to develop guidance specifically relevant to human health hazards, including NIOSH in the United States, of course, their counterparts in Canada, Germany, the United Kingdom, Japan, and Australia, just to name a few of the more advanced efforts. And each of these has a document that's publicly available on the web. A few regulatory actions have been taken or are being explored. Most of the significant actions in the U.S. have been taken by the Environmental Protection Agency. In accordance with provisions of the Toxic Substances Control Act, nanomaterial manufacturers have submitted registrations for dozens of nanoscale materials prior to the manufacture. And EPA has issued decisions on carbon nanotubes specifically that recognizes them as new substances and requires the use of protective measures to avoid exposure in the workplace. EPA has also levied fines against companies that have failed to register nanoscale products making antimicrobial claims, a requirement under the FIFRA Act. And these actions, in my opinion, portend a shift in approach away from the voluntary programs that were taken a few years ago for data reporting toward mandatory requirements, and I expect this will continue in the future. The most significant development outside of the United States is the European legislation known as REACH, which has strict reporting and testing requirements that will apply to nanomaterials. REACH applies to all chemical substances, even if they have been sold for many years. The European Parliament has been asking for nanoproducts to be identified with a product label so that consumers can make informed choices about their products. But this decision or this request is not without controversy. There's still a perception among many that guidance and existing regulation are not enough to address the yawning knowledge gaps. In response, established international or intergovernmental bodies are engaging in their own processes with participation from governments. The Organization for Economic Cooperation and Development is an intergovernmental body that works on safety testing of representative sets of nanomaterials and testing guidelines for assessing nanomaterial toxicity, among other projects. The International Organization for Standardization, ISO, is a multi-stakeholder standard developing organization that's developing voluntary consensus standards on nanotechnology in 4 critical areas, including environmental health and safety. And the World Health Organization, of course, is a non-governmental organization working through its collaborating centers to increase the readiness of emerging economies to safely handle nanomaterials. And finally, several grassroots groups and consortia have been formed, among which are the Good Nano Guide, an online community resource for developing and sharing safe handling protocols. It's administered by the group that I direct, ICON, under the guidance of an international implementation committee. The International Alliance for NanoEHS Harmonization is a grassroots effort by research scientists to develop validated testing protocols through the sharing of samples and test methods. NanoImpactNet is a European Union-funded program for coordinating test strategies and methods, screening tools, risk assessment tools, and methodologies. And the NanoRisk Framework is a risk management framework for nanomaterials developed through a partnership between the DuPont Corporation and Environmental Defense Fund. One of the key players is helping to put this information together is the International Council on Nanotechnology, which I direct. ICON is a multi-stakeholder organization that aims to develop and disseminate information about potential risks of nanomaterials so that they can be addressed and nanotechnology can develop sustainably, and we can reap the wonderful public health benefits that you heard earlier. ICON's major outputs include a survey of handling practice, the development of research needs for predicting nanomaterial behavior, a comprehensive knowledge base of scientific and policy documents related to nanomaterial environmental health and safety impacts, and the Good Nano Guide, a community resource for sharing protocols for safe handling. All the information is freely accessible from our website. There's still much left to do. We need focused research of high relevance to occupational health, risk control strategies that can be implemented now, and outreach and training for workers, researchers, and occupational health professionals. In other words, we need a focused and comprehensive effort that leverages all of these existing efforts, pulls them in together in a broad partnership, which would be more effective than the scattered and diffuse efforts that are underway today. A proposal put forth by NIOSH would engage stakeholders from multiple sectors to generate knowledge that will inform risk control strategies and standards to protect workers and the environment now and as new knowledge is created in the future. Thank you. I believe it's time for questions.
Floor is open for questions. Dr. Frieden.
I think you've convinced us that nanotechnology has tremendous potential, both to benefit and tremendous potential to be an occupational and environmental risk. I think after hearing the presentations, it's harder to have a sense of optimism about how soon we'll have the answers to the key questions in risks of nanotechnology. So I wonder if any of you could summarize two issues. First, taking Dr. Kolnowski's last slide, what are the current technologies that need to be applied using the best available knowledge? And what is the status of getting those applied widely? And second, what are the key research questions, both in terms of methodologies that need to be developed and in terms of specific nanoparticles that need to be investigated? Is there consensus on that, and how can we expedite the work that needs to be done?
I'll give it a start. The good news with nanotechnology is that we have a lot of tools in place that will allow us to help control exposures. We have over 100 years in the pharmaceutical industry in dealing with biologically active dusts and means to control it. We don't expect that nanoparticles will act physically in air or in fluids that much different than other dusts. So we think we have approaches for control, albeit there are limits to those approaches that we still need to study. So particles within 1 to 5 nanometers, we need to study further to see if there's limitations. Issues of agglomeration in air we need to study, but we think we have the controls that we can recommend. Clearly, though, we're lacking a lot of the tools to accurately apply those controls. First of all, if we're going to have controls, we need to have exposure limits to evaluate the effectiveness of the controls, and we're still debating on what is the appropriate exposure metric. Should it be size? Should it be surface area? Should it be particle count, particle number, different kinds of characteristics like this? We don't have the technology to do this in the field on an individual basis, so we can't effectively and practically get worker breathing zone exposure measurements. So while we have some control technology, we still have needs for the tools to apply it. Yes, please.
We also have great hope in the National Nanotechnology Initiative that both Vince and I alluded to. And this is a consortia of 25 federal agencies that come together on a monthly basis to, and through our Health Implications Working Group, we have developed a federal research strategy that addresses these critical questions that you're asking about. In fact, we're in the process of iterating that strategy now based on state-of-the-art over the last 3 years, the developments in science. And what this consortia does is it brings together NIST to head up the metrology and methods portion. NIH heads the human health portion, EPA the environment portion. So you bring together the federal agencies whose missions are specifically addressing many of the questions you've asked. NIOSH leads the exposure assessment question. So we have this integrated approach. We have not answered all the questions. We feel like we understand what they are, and through continuous dialogue, we are leveraging our investments, we are collaborating to fund research that will get us the answers we need quickly. So that's how we're trying to move forward and address those key questions. So we feel like we understand them and are moving forward on it.
One last comment that I'd like to give is NIOSH does have data that regular industrial hygiene practice does work for products, nanoparticles. HEPA filters work, respirators work. You asked about the strategy for testing the potential harmful effects of these nanoparticles. The NIOSH strategy is to try to build a matrix of physical and chemical properties versus bioactivity. And so we're working with material scientists to get a well-characterized set of nanoparticles where we alter one physical or chemical parameter at a time, and then try to see how that affects the bioactivity of that material. And that way we'll have some predictive ability, because with the thousands of materials out there, it's going to be impossible to test every one.
One final point. We held a workshop in 2007, 2 workshops actually that Sally was heavily involved in. And the goal was to understand what it would take to predict nanomaterial behavior in biological and environmental systems, building on Vince's comment about relating the material properties to their activity. And the experts that we convened in these two workshops, who were the top people in their fields, determined that it would take at least 10 years, this was only 3 years ago, to get to a point where we could understand, where we could look at the nanoparticle, characterize it very well, and then correlate that with some kind of an impact. And among the problems that they identified were the dynamic nature of nanomaterials, that a nanomaterial doesn't stay the way it is when it's manufactured. So we have to understand how proteins and other materials will adsorb and desorb from the surface, and how they may agglomerate or de-agglomerate either in the body or in the environment. So that was a critical question. The issue of dose and dose metrics need to be standardized, and to validate the existing tools that we have in occupational safety and in toxicology to make sure that we're not getting false positives or false negatives from those standard tools. And so those were among the high-level challenges that group of experts identified, and we're still struggling with those today.
One final point. Under the NNI reporting system, the federal government has a $117 million investment in environmental health and safety research across all the federal agencies. So that's a significant amount that we're investing to answer your questions.
Okay, we have people lining up at the microphone. Dr. Singhs.
Thanks, Paul. I have two questions. One is, given emerging chemicals or nanoparticles, this is always an issue of determining the toxicology. We frequently look at hazard models and computer technology and animal tests, but the real gold standard for us is human data on health effects. And I'm wondering, first, if NIOSH has had any opportunity in health hazard evaluations or industry-wide studies to look at human health effects. And the second question I have is for the gentleman from Georgia Tech, which is, given this uncertainty about worker safety and health and the limited information you have to protect your workers, what are you actually doing to look at that, given that you have people at Georgia Tech who are working with the materials?
Well, first of all, they're only graduate students. They're not actually real people yet, so they're just, you know. Well, we're following NIOSH standards, and you know, I think it would be good for us to do an excellent job of that again, given that once they become real people and go out into the world, and it really is the world, that they kind of know what the safety handling issues are.
Regarding the health effects of workers, the epidemiology and the epidemiologic approach is complicated. The workforce really came online in the 1990s and 2000s and has gradually started to increase. Given the diversity of nanomaterials and nanoparticles, there will be a challenge in finding cohorts of workers with the same actual exposure. And adequate latency, given the short time since the materials have been in production. So consequently, we are looking at what kinds of short-term cross-sectional studies can we do now while we plan longer-term chronic studies. Clearly, when we form cohorts, we may not be able to use exposure to individual particles because of all the different variables that could mitigate particle design. So we're thinking of binning the particles according to mechanism of action. So all the particles that produce reactive oxygen radicals, we might make a cohort with people with those kinds of exposures. But this is the area of discussion right now. We're holding a conference in Keystone in July to address the epidemiologic and medical surveillance issues.
One final thought. We're hoping that the Good Nano Guide, this online resource of handling practices, will be something that graduate students and postdocs, trainees can turn to answer the questions. I get questions a lot from graduate students. I'm working with quantum dots. Should I wear gloves? What kind of gloves should I wear? Do I need to be wearing a respirator when I'm working with carbon nanotubes? And that's the kind of practical information for practitioners and researchers that we're hoping to collect at the Good Nano Guide.
Question over here.
John Iskander, CDC Science Office. Thank you all for, in the last hour, bringing my knowledge beyond science fiction. Wanted to ask two related questions. I was struck by the framing of the title, which is Preventing Adverse Health Effects from Nanotechnology. You all, I think, provided a lot of information about, two of the three pillars, risk assessment and risk management. The third pillar from a medical product safety standpoint is risk communication, and I'm wondering, is that framing in terms of preventing adverse health effects, is that going to kind of sort of shape the discussion down the line, thinking of potentially relevant examples like genetically modified organisms? Are we, in a sense, from a risk communication standpoint, are we focusing excessively upfront on risks, or is that simply a reflection of the knowledge gaps?
I think the history of looking at past emerging technologies is that the ones that failed often failed because society did not take the concerns of many parties to heart. And so while there is a lot of discussion about the societal benefit of nanotechnology and investment in that aspect, there's a lot less in terms of the adverse effects. So I think it's appropriate in this setting to just discuss the adverse effects. But you're right, the big picture needs to be portrayed, and the relative costs and benefits need to be assessed. And indeed, in other forums, that's occurring.
And then I just had a workshop late in March where communication was a big issue, and communication not only of the risk but of the benefits, and so that the consumer can make a rational decision.
And just one follow-on from that, the idea of setting up exposure registries for workers involved in the manufacturing and production and use of nanomaterials is in part to allow better and more adequate risk communication in this interim period between when we can actually do epidemiologic research and have adequate hazard information, but to share with those who are currently exposed what we know about the potential hazard and the controls. Over here, please.
I'm Jim Bueller from the Public Health Surveillance Program Office. I have a question about the nature or the definition of these particles. And perhaps I misunderstood the first presentation, but I thought I heard an implication that particles of this size may occur in nature or may occur as a byproduct of industrial activity or explosions. Is that correct? And if so, then is there a distinction between the inherent risk of exposure to what may be naturally occurring as opposed to a manufactured nanoparticle?
You're correct. Nanoparticles have been in the environment for some time. For instance, volcanoes can generate carbon nanotubes. Welding processes, diesel exhaust generate a sub-fraction of particles that are nano in size. We call those incidental nanoparticles because they're not made on purpose, but by side effect. The difference between an engineered nanoparticle and an incidental nanoparticle is the purity of the characteristics. The engineered nanoparticle will be tightly controlled, so it has one composition, one characteristic, one physical dimension, etc. And so you're dealing with, instead of a mixture of effects, more of a pure effect.
Also, from a biologic point of view, the body doesn't care if it's an engineered nanoparticle or a natural nanoparticle. And so as we do exposure assessments, we have to account for background issues of nanoparticles that might come off of copiers or sweepers or forklifts. And then ultimately, when we talk about pulmonary or organ system insult, we need to consider not only the effect of the engineered nanoparticles, but any of the background nanoparticles. Over here, please.
Thomas Morris, Office of Public Health Preparedness and Response. The previous person here, the commander, took a lot of my question here, but as I was struck by nanotechnology, which, thank you all, I have a better understanding. Still, in my prior life in state public health and as an infectious diseases physician, the risk communication here of how to get it out is much of a positive light because, to use two examples, we still have a lot of very intelligent people making very foolish decisions when it comes to vaccines, and the other, in regards to food safety, I don't want any of that radiation on my food because I'll glow in the dark. And these are, as this is starting to diffuse out into the public, so far the one gripping facet of this is the World Trade Towers. So how are you going to be prepared to try and break through about the positive benefits and also assessing the occupational risks without the rumor mill and the misinformation, which can take a life of its own?
There's been an extensive body of public perception research that has, by social scientists, that has studied what the public's attitudes about nanotechnology are and compared it particularly with other types of high technology. And most of the studies conclude that the public doesn't really know very much about nanotechnology. So we are kind of starting with a blank slate. And that means we have an opportunity here to, when people do start to begin to understand the nanotechnologies in their products, to answer their questions about potential harm with the body of scientific data that we've collected over the years. The other point about that is that information about nanomaterials in products should be communicated where appropriate all along the value chain. So we need better risk communication from a business-to-business perspective when a native nanoparticle is sold to a formulator and then the formulator puts it into a product. We need consumers to understand if there are special issues related to how they use that product, or whether they should maybe not, cut their bike frame because it might have nanoparticles in it. So appropriate and responsible use of the products needs to be better communicated. And so we really have significant work to do to create and refine our risk communication strategies, both in a business-to-business context and in a business-to-consumer context. We have some time because public opinion has not yet been settled.
Sally?
I just wanted to mention briefly that the National Science Foundation has funded several centers to look at educational aspects of nanotechnology, how to educate students as well as the general public. They fund a network of centers that have developed programs for museums and other public locations, public libraries, where they can take these traveling displays, have hands-on experiences for the general public. So there are a number of activities going on to start this public education component, and it will continue to increase. And across the federal government, we recognize that, and it will be a larger component of future work that's done.
Last question, Candace.
Candace Mayweather from ATSDR, and I just wanted to mention I was one of those graduate students dealing with carbon nanotubes, so no offense though. But I wanted to ask, you mentioned that REACH is looking towards labeling materials that have nanoparticles or nano-enabled. And I wanted to ask, do you anticipate the United States labeling sunscreen or any other materials that are nano-enabled anytime soon? Or?
The label in question is one of great controversy. That's an understatement. And the proposal, the European Parliament is requesting that products that have nanomaterials in them that are sold in the European Union have information that there's nano inside on the label. So far, that recommendation has not been adopted. I think in more general terms, the United States, people in the United States and government and industry are looking closely at the European approach to toxic chemical substances and how nanomaterials will be handled under this very new legislation, REACH, which just is starting to come into enforcement right now. It will impact regulatory decision-making in the United States, I would predict, and it will put pressure on United States regulatory officials to continue to examine and explore their approach, their enforcement of U.S. regulations. REACH will not be enforced in the United States, but of course it will influence U.S. thinking, and it will influence commerce, transatlantic commerce. So for those reasons, it is very significant and something to watch.
Well, thank you all for your attention, and we'll turn the podium back to Tanya.
You can imagine that working with these 6 colleagues has been an outstanding experience because they're probably 6 of the most intelligent people you can imagine. And I really want you to give them a round of applause, and we'll see you in 4 weeks, same time, same place.